Hey guys, Dr. Stavros here. If you're in med school and you need help with USMLE test prep, in less than 60 seconds, I'm going to show you a live 1-hour USMLE study session. I'm going to show you techniques and shortcuts you can use to instantly boost your USMLE score. You're going to get live analysis of me walking you through AMBOSS questions, where I will show you how to exactly apply the content you learn in med school to the exam. You're going to learn how we leverage high-yield topics like microbiology, immunology, and biochemistry and apply those concepts all across your USMLE exam. And more importantly, guys, I'm going to show you how to actually study, what content and questions to focus on, and how to stay accountable and consistent in your study routine on a daily basis. So check out this entirely unedited live study session and see how working with me is going to help you pass your exam with confidence. I usually say this, and I'll say this again, weekends come around. It's nice to spend time with family and friends, but honestly, if your test is coming up soon, you should definitely focus on getting this done as soon as possible. Don't have that fear of missing out. You're not going to miss anything, I promise you. You're going to miss your exam. You're going to miss your score. You're going to miss the time spent relaxing too much because I wish I had more time, right? And I'm telling you this because I care for you all who are here now, watching this later, watching this tomorrow, next week, or whenever you're watching it. Time flies like this. So that's why today, even though it's a Friday morning where we'll do biochemistry, I will definitely have, I put some questions in the mix that are review from the week. And you'll see it when you see it, right? So this is a good way to introduce and show you that what I do each and every day, what we do here each and every day is a sense of a review to use problem solving to help us have that leverage. It allows us to highlight what we know versus what we don't. All of us internally feel we know something, which is great. And then what happens is we answer some questions. But we have to keep in mind that the questions that we have in front of us are not fair. Most of them are not fair. And because we know that they're not fair, we're prepared to attack them on our playing level, right? Our playing field. Typically people and students and physicians that attack it the way they normally attack it, the way they've been attacking other questions, they eventually see that there's a problem. They see that the questions are not fair. The questions don't make sense. The other day we had a question, one of our doctors was upset or was not really agreeing because it really had something dealing with vaccinations and a young child. And if you're practicing medicine, like a lot of you watching this now later are or have or currently practicing, you realize there's a conflict of practicing in the hospital versus step one test taking. And to say maybe we overthink or complicated things, we do. Yes, we do. So if I'm connecting with you now, and this is what's going on with you, you have to use this formula that we have each and every day. Read the scenario a certain way, know in your heart, in your mind, that there's ways to answer every question. We do it the same way. Read the last 2-3 lines, okay? If we have enough evidence, enough pertinent findings to lock in the answer, click and next question. If we feel we need to solidify and we maybe confirm or we need more information, go to the top, read the whole scenario. Then either you have the answer or you eliminate the other answers to highlight the answer that's left. If that doesn't work, you flag it, you move to the other questions because it is a timed exam. And at the end of the block, you go back and say, well, whatever I flagged, I could either spend 10 seconds to figure out which one of the answer choices I left are correct, or choose the lowest letter and move. And that right there, guys, is a step-by-step process of how you attack every single question on the STEP exam, especially step one. So if you have that locked in well, you will come out passing the test. If you allow the exam to get you, if you allow the exam to mess with you, if you allow the exam to slow you down, to throw curveballs and for you to take the bait, then I can't help you. At that point, it's you against them, and you will not do well because they mess with you. Think about it. Questions are always random. They're difficult levels from 1 to 5, whatever rating they have. So you might have such a horrible question that takes up so much of your time. And the next question could be like an easy scenario, but because you're just so upset from the previous question, that you mess up the next question. So that's why a test taking skills, it is a skill, right? It's a certain habit. It's a certain routine. You have to get into this into this zone. And that's why typically anyone you ask anywhere in the world who's studying for the test, who has studied, will tell you more questions, the better. Of course, the more questions you do, the more practice you have. The more questions you attack, the more ways of approaching your technique and improving your technique. But you also need to assess your performance when you go play sports, right? Your coach, your mentor and coach says, hey, listen, do it this way. Hit the ball this way, swing the golf club this way, swim this way, right? If you don't have constant feedback, how will you improve? Same thing here. Difference is, do you have one of us as a team helping you, or are you on your own? If you're on your own, you need to ask yourself why each and every day. A lot of us eventually stop asking why, and we say, I know it. And then when you do get the questions, you get them wrong. You said, why? Why? Because you don't know the content or test taking. So today's Biochem, a couple of good questions on board. Typically I bring on all new questions, or recently, I switch them often, because if you're with us every Friday, you'll see similar questions pop up. But in one full month, we attack biochem 4 times, we attack microbiology 4 times, immunology 4 times. Organ systems we cover in a month, each organ system. So typically in one full month, you see the big 3, which is microbiochem, immuno, 4 times a week. So 4 times 3, or 3 times, once a week times 4 weeks, that's 4 times a month each. And then the organ systems twice in a month. So if you're stuck in cardio, I can promise you'll see a lot with us in one full month. So we're going to do biochem. Typically, as you all know, I ask whoever's participating here live to jump on, answer questions with me, just because I want to see what you know. And also you have the opportunity to apply your knowledge to questions. And as you know, we use AMBOSS, and AMBOSS is pretty good because they have a lot of different diagnostic tools that we utilize, whether it's the attending tip, the key findings, combination of both, or, hey, I need to learn more. Dr. Anthony says, I think I need more time now. Yeah, just so you know, you'll never feel totally ready. You'll never think you're done, right? Because there's always tons of info. But because the step 1 is pass or fail, doesn't mean you study less. It just means that if you're constantly taking assessment tests and you're scoring above average, let's say 65 is the average, or 67, and you're constantly passing every single assessment, meaning you have UWorld self-assessments, you have AMBOSS self-assessments, you have NBMEs, online and offline, and you have the free 120. You have an old version and a new version. If all those assessments, you're scoring above average and you're doing well, what is the hesitance? What is the doubt, right? The only doubt and the fear is the unknown. Well, I don't know what they're going to give me on exam day, right? I had an idea before even Dr. Andy goes, fear. There's a fear. Fear of failure, a fear of not knowing how to answer the question. But we all know, I've already acknowledged and announced that every question will be brand new. You will never see the same question ever. There's no way you'll see the same question. Maybe you'll see 1 or 4 questions from the free 120 that you've done pop up on the actual exam. Maybe, right? Maybe. It's not guaranteed. So it's going to be all new questions. It's going to be the same medical concepts. It's not going to be anything new you haven't seen. It's just going to be presented differently. All right. So if you have a formula we just walked through earlier, step by step by step by step, and you attack every question the same way, knowing that if it's a long question, flag and move. Don't want to take that unless you've been practicing to do it immediately. I usually leave them to the end because I know they're big ones. And I don't know about you, but I get really pissed if I go ahead and I go and read the whole scenario. It's about 3 or 4 paragraphs long. And then after I read the whole scenario, then I'm not really ready to answer the question. So now I've chewed up 3, 4, 5 minutes of my time. And then after that, I have to continue moving forward. And when I move forward, I'm hesitant because I don't know if I answered the previous question correct. So you see, the test got into my head. And because of that, I might not score well on the other questions moving forward, right? That's why fear and lack of confidence. I can tell you one thing, ladies and gentlemen, because Dr. Singh and other doctors here are mentioning that. The only way that I can give you my thumbs up if you work with me. And the only way you can feel confident is if you literally have taken as many assessments as possible and you're scoring above 65%. If you're walking in and you're scoring 62, 58, 68, 61, it's not consistent. The problem is, will that happen on your exam day? And one main thing before we begin, because we add value each and every day, whether we have our morning sessions, afternoon sessions, when you're with us, when you're in our system, we always give you value. We always bring on success stories. We want you guys to pass. If you're ready to take an assessment and you're ready to know, hey, am I going to pass the test? Well, the test is 7 blocks, not 3. So if you're typically used to doing 3 blocks a day or even 4 blocks a day, are you confident that you will walk in on exam day when there's 7 blocks to do and do well? Meaning, will you be able to sustain endurance, right? Will you feel good and energetic throughout the whole day? Will you be able to have focus and concentration? Will you be able to answer questions on the last block with enough energy and concentration as the first couple? Because I always use an example of running. If you want to go run a marathon, right? 26.2 miles. If you can't get to 10 miles on any given day, how will you wake up tomorrow and run 26.2? You will not. It's impossible. So if you cannot finish 4 blocks, random timed, with little breaks in between, 5-minute breaks in between, if you can't do that, I can promise you, I don't know, I mean, a lot of us are watching this now, participating. Other ones will be watching the recording later over the weekend and so on. If you can't do that, there is no way, I'm telling you right now, Dr. Stavros on a Friday, that you will go in and pass the test on the exam day. Just like running a marathon. If you can't do 5 miles, you can't do 26.2. So I use examples like that because a lot of people out there feel that, well, I'm just going to do it on exam day. Okay, good. And they come out and they fail because they didn't test themselves. Now, you might want to ask this yourself. You maybe want to answer your own question that I asked. Why do people walk in not confident? Maybe they're scared to do an assessment. Maybe they're scared to see the reality that they're not ready. Maybe they're forced by family, friends that they have to take it soon. Maybe their window is exhausting, like the deadline's coming and they can't extend it. They don't want to pay another fee. The point is, if you plan in advance and you have us to help you plan and help you stay on schedule each and every day, right? Accountability. Well, those of us who are here every day, you see the progression and you see performance and you see the numbers rise. Other people who don't have accountability, don't have a study partner, don't have a team like we do, well, they come and go and they're tired and they skip a day, skip 2, and they realize it's a half a year in and I'm not where I need to be. Well, you haven't been disciplined. That's just tough love. You haven't been treating it like a full-time job. So I can promise you, no one ever walks in fully ready, but they're confident because, hey, I've taken all my assessments. I've scored above average. I'm passing everything. I know how to handle myself on every question. And when I get a curveball thrown at me, like Dr. Anthony is like, man, 4 or 5 hammers. Well, 4 or 5 hammers on AMBOSS are usually the 5%ers of questions you get on the board exam, right? So think of it this way. If you mix the 4 or 5 hammers, meaning the more difficult ones in your daily routine, then on exam day, you'll feel pretty good because like I'm kind of exposed to easy questions and very challenging ones versus I'm going to feel comfortable. I will do the bank. I'll do UWorld 3 times over again. I'll score my 82%. And then I go take the test. That's false positive. So I can honestly tell you today live that I've worked with many students who've had attempts and come to me after they've attempted once or twice. And the common denominator is I used 1 QBank instead of 2. And I basically did the QBank multiple times. And I did NBMEs over and over again until I did better. All right, but you realize that you just gave yourself false hope to walk in and do well, but you've seen the same cases, the same differentials. That's why you didn't do well, right? It's like, I give an example. I play with one of my colleagues, sport like tennis, and I kick their, I do well, and I really destroy them every time. And then I go play somebody else and they destroy me. You see, they always have to keep improving. You can't just feel comfortable in the same QBank doing everything over and over and over again. Because if I play the same competitor and I'm kicking, I'm beating them up all the time, and I'm destroying them on the tennis court or the basketball court, then when I go play somebody else, they're better than me. I'm going to get destroyed, just like the exam. If you're usually doing one QBank and you feel really confident, well, if you have time, do a second QBank. So I tell my students in the step one success system here that we say each and every day, start off with AMBOSS, hit UWorld after, hit both QBanks if you can. All right. So that was my morning Friday push. You got to study. You got to do it well. Don't be in fear. Don't feel lack of confidence. You will not be walking into your exam unless I can give you my approval, unless you're in my system, right? Then know that I'm here by your side to make sure you're going to be okay, especially even up until exam day, because typically I talk to students the night before, the day of, and then we debrief the day after, or the morning after, the same day. All right, guys, I want you to raise your hands. I have a few people here. Let's do some questions. I have a couple curveballs ready for you, which is kind of cool. Let's see if you can hit them. And I want you to do questions with me. I can tell you there's some drug questions in here. They're from everywhere, just because I want to make sure you guys know your pharmacology. So there it is. And because of that, I have my pharm blended in with anything else. But I want you guys to do some questions with me. And let's see here. I'm going to pull up the first one. All right. I'm going to pull it up and do it. And then whoever wants to jump in after can jump in. So I'm going to share a screen here. Typically, when we do questions, we use AMBOSS, as we all know, every single day, twice a day. So I pulled up some pharm because we have done organ systems in the afternoon. We do micro, immunobiochem in the mornings. So on Friday, I want to make sure that you guys have been reviewing throughout the week. So besides biochemistry, which I have biochem questions lined up, we do it 4 times a month. I want to make sure you guys know your pharmacology, because I've been getting a lot of emails and reaching out from people on social media. Hey, how do I improve my pharm? How do I improve my pharm? It really is simple. Open up your first aid, use a bank like AMBOSS, use focused training, problem solving, and then hit every question they have in anti-diabetics, for example. So if you can see anti-diabetics and you have all the different drugs, all you need to know is the medication, which you can put in a classification category. You have an MOA and adverse effects. That's it. Now, I can promise you, if you can do those in every system, then clearly you have an advantage over the majority of people taking the test. If you're going to go focus on pharmacokinetics and dynamics, you're going to lose, because that stuff is hard to learn. I'm not saying you can't learn it. I'm saying that you have all the time in the world to learn it through videos, but the points are literally waiting for you in every organ system, because every organ system has pharmacology, right? It's easier to put together than learning competitive, not competitive inhibition and Vmax and Kmax. I'm biochem major. And then you go through in detail in undergrad. Med school, 2 minutes. So a question like this, we usually do this. Let me open up my screen so you guys can see. And usually I have you all chat away in the chat box, because I want you guys to participate. Audio and video is off. So I hope you guys are awake and alive and doing well, and chat away at your leisure. So typically we do is we always read the last 3 lines first, because the last 3 lines for us gives us an advantage of A, knowing what the question's asking of us, and B, maybe we have some juicy information that's going to allow us to knock out the answer and move on, to save time for other questions that are a little more challenging, right? So treatment for his condition with an appropriate medication has begun. In response to this drug, pancreatic islet cells begin producing increasing amounts of secretory granules. So for me, when I read something like this, obviously a lot of people have different approaches. I read the last 3 lines, and if I took a glance at this medication list regimen, I'm looking at diabetic meds, right? So clearly, as you read the scenario here, the patient was most likely treated with which of the following drugs? I like to go to the top, no matter what, because when I go to the top, and I tell my students to do so as well, you read the whole scenario, you confirm what you're thinking, and it allows you to read the last line a second time. So it minimizes any chances of making silly mistakes of, oh, I didn't see what they're asking me, right? So after you read the last 3 lines, okay, you go to the top. A 56-year-old man comes to the physician for evaluation of gradually worsening fatigue, increased urinary frequency, and blurry vision for 5 months. He has not seen a doctor in several years. Okay. So typically they throw these kind of little findings in the scenario to show you that they're not compliant, or they haven't seen the physician in many years, or they're just not taking their meds. PE physical exam shows decreased vibratory sensation and proprioception in the lower extremities. So now I know you're formulating something in your mind. You may be thinking maybe they're diabetic, right? Then they throw you HbA1c, right? They throw you hemoglobin A1c. Because they throw this, typically it's 6.9, 6.9 and below. Clearly now it's confirmed a person's diabetic. Here's the problem. And this goes to every pharmacology question that attacks or approaches every organ system, right? Not the pharmacokinetics and dynamics. I'm talking about all the organ systems. There are 9, plus micro, biochem, and immuno. Those are topics. If you look at the answer choices here, and you can't honestly tell me what these are, or you can't even categorize them in certain, the categories, right? Like which ones are, increase insulin sensitivity, which ones increase insulin secretion, right? Which ones are the ones that decrease glucose absorption in the kidneys and also in the intestines. If you can't do that, it's very difficult to knock out the answer. Do you guys agree in the chat? Thumbs up if you agree. You're like, yeah, man, thumbs up. And thumbs down if you don't agree, because you have a different answer, right? So typically you have to be able to tell me or tell yourself what these drugs are, right? So now, when it says in response to this drug, pancreatic islet cells begin producing increasing amounts of secretory granules. Well, I know that when you open up your first aid and you have the different categories of anti-diabetic medication, there's some that increase insulin secretion. Now, either you, feel comfortable enough to say, well, insulin secretion, I know what it is. I know the drugs, right? And my team, my students that I work with, we use the phrase buy one, get one, because out of all the drugs that are in the categories, there's 2 types of drugs that are increased insulin secretion, meaning pump insulin, and they have the same MOA, right? So what I like to do is, because this course that we created here, USMLE Training, is specifically tailored, and the objective to this was to help you be a better test taker, really to really leverage the exam. So even if you coming in knowing the information, can you really know how to pass this test, right? If you see these drugs here, it's safe to say if you don't know the drugs, you're in trouble. Okay. So can you tell me here, guys, if we're looking at increased amounts of secretory granules, we're looking for drugs that are increased insulin secretion. Can you tell me in the chat box what side effects, what patient will see if we have insulin secretion drugs? And as you answer that, I'm going to keep moving. So we have drugs here. We have metformin, zone, rides, arquebus. Very good, Dr. Anthony. We have low sugar and weight gain. We have these other drugs, arquebus, Flozins, insulin. So looking at this now, what I like to do is this. Can you guys tell me, the chat box away if you like, which one of these, because some of these fall in the same category like we talked about, right? There's 2 drugs here that literally help decrease glucose absorption. One drug we use that actually stops the sugar from being absorbed in the PCT, and that then causes glucosuria, right? And vaginal candidiasis and other things. And the other drug actually stops absorption of sugar in the intestines. So can you guys tell me which one? And Anthony's on board on the East Coast from Jersey. He's telling us arquebus and Flozin. So arquebus and Flozin are 2 drugs here that are in the same category. They decrease sugar absorption, right? Boom, knock them out. So typically, I hope you understand, the way the USMLE questions are structured, some are very easy and some are very doable, meaning you read the scenario, the answer is in the question step. You just got to put the pieces together. Awesome. Other questions you got to memorize. Other ones you need to know most common associations, common factors, risk factors, whatever. Something I usually reach over my right shoulder. Something from here you need to know to plug into the question stem. And that comes with practice and time. So we take out these 2. All right. Now there's 2 drugs here that One is given immediately when a person is diagnosed with diabetes, and the other one, and that causes lactic acidosis. Can you guys tell me which one that is in the chat? There's a letter to this one. And the other one actually activates PPAR gamma. It's a nuclear receptor. Typically, you tell the patient, Mr. Smith, I'm sorry, but the drug is great. It's going to take time to work, right? Delayed action, a couple of weeks. And also there's weight gain. There's edema. There's heart failure possibly. And you have a high risk of osteoporosis. But don't worry about it. The sugar, we got you. We're going to lower the sugar, no problem. So I need to know those two drugs, right? You see the answer choices here? We took out these two. Now we have these here. So one Dr. Cooper says zone. The zone is a drug with the PPAR gamma, right? It activates PPAR gamma. So that's out because that is along with the metformin. If you open up your first aid, guys, it's right there. You see those two drugs, insulin sensitivity, increased insulin sensitivity. So both metformin, which causes lactic acidosis, and also there's another thing to remember. It also causes vitamin B12 deficiency, right? I hope you realize when you read first aid and your notes, please don't always go back and read what you know. I know you know it. Read something else that's involved in the answer in the description, because that extra bit of information could be the one that the test writer can use, like B12 deficiency. That's not really commonly talked about, but it's a possibility for metformin. So these two are out. All right, now we're down to two. Now I know you don't give insulin, right? You just don't give insulin. There's no reason to give insulin. Because at the same time, now this is a pancreatic islet cell producing. You're pumping insulin. You're pumping the cells. You're pushing them to create insulin. So the answer has to be this here, right? Now, I know I took the long route because you're here on Friday morning, so I could show you guys what we do each and every day, and also to show you that even though we're doing biochem, I'm going to throw curveballs. I'm like, all right, do you know some pharmacology we did this week? And I want you guys to push yourselves hard on the weekends and say, now the weekend's here. I need to review what I did during the week. And if you're a fear of pharm or you're not a fan of pharm, I typically tell my students, spend some time on the weekend and make focus blocks up and work on everything you did during the week. If we did cardio, this week we did endo, we did female repro, we did GI, we're doing GI this afternoon, HEMONC, and everything else, MSK. You should be focusing on pharmacology, parallel what you've done for the week, right? If you go back and look at the numbers, 61%, 19, 10, 2, 3, 6. I mean, metformin and zones, you know that those two are actually, yeah, let me show you something, guys, as we're talking. Let me show you something. This is what I do each and every day with our students here. Let me minimize my window. So then if I minimize it, give me a second, I can then share my screen and bring something else on board. When you're looking at your first aid, which I know we all have a first aid, whether it's under your pillow, whether it's next to you, a digital copy, whatever the case might be, this never changes. The medication is not going to take away. They're just going to add, if anything. You should be able to categorize these. There's two drugs here. There's two drugs, well, two classes of drugs. These are two classes here. I mean, this category is two different drugs. And then the last two here. So if you're able to tell me the decreased glucose absorption, which are Flozins and arcabosmetolol, awesome. These are famous. A lot of doctors out there prescribing medication. A lot of patients who are overweight are getting certain drugs, right? It's a new thing now, which this drug actually is awesome. The GLP-1 analog, because not only does it help you lose weight, also actually fills you up faster, right? You're not too hungry. A lot of people are using this, whether they're diabetic or not, and the doctors are prescribing this drug with great results. This one here I call buy one, get one, because all these drugs here, the mides, the zides, the rides, the nides, have the same MOA. That's nice in the USMLE world. Less things for me to do. And as we say, if you pump an insulin, guys, wait, you have low sugar because you put the switch on, you can't stop it, right? And weight gain. And these two are always, for some reason, misunderstood. I think people don't really know the MOAs. You should know it. Either you A, read this and memorize it, which isn't my advice, or B, read it once or twice, open up some questions, and apply its application. That's what I do with my doctors every day. We apply things, right? So if you know something, apply yourself to it. When you go see the patients in the hospital, you read up on the patient before, you go see the patients with your attending, and then you read up after to make sure you've understood what's going on. So a table like this, don't do what I did when I was a med student. I would just memorize, slam it in my head and memorize, and then memorize every other page, and then forget stuff in a week. That's why I can't do that anymore, nor can I respectfully tell my students, memorize everything. That's the easy way out. And unfortunately, it doesn't really work too much. So go through these answer choices over and over again. If you look at the answer choices and you dissect each one, you can then get more for less. You could do 10 questions and then you get back 50 responses to 50 answer choices. So read through this at your leisure. The doctors in my system, we have access to all the questions that I provide each and every day, so you guys can review on your own. Awesome. Any questions on this one, guys? Just curious. I know a lot of us know the medication, but remember, you need to get points to pass this test. Don't focus on something with pharmacokinetics. Focus on, well, there's 9 systems. They're going to give us medications, anti-diabetics, anti-arrhythmics, antithyrotics, anti-epileptics. I mean, they're going to give me micro, bacteria, viruses, parasites, fungi. There's drugs for each one. There's MOAs and adverse effects. You see all the points that accumulate? No, I'm going to do epi, and I'm going to focus on pharmacokinetics. Okay. Do you know the other drugs? No, not really. So how about you do those first? And then after, when you have time, which you will never have, but if you have time to kill, then focus on Vmax, which literally is it's not gonna make you fail the test if you don't know Vmax, right? But if you don't know Vmax, if you don't know pharmacology and all the organ systems, if you haven't brushed up on microbiology, if you haven't brushed up on immunology, then things add up and then the person doesn't pass. So I'm telling you guys because I care. That's the thing. Who wants to do the next question, guys? I know this. I know all this information. I need to see that you guys know this information because I can go all day. I already passed my test. Let's see. This one here is a pretty good question. Let's see. Anybody wants to jump on and do a question? Raise your hand if you'd like to. If not, we'll keep moving and shaking. This question here is, let's read the last answer choices. Or check. Actually, let's do this one. You guys know your formulas? Actually, you know this one first. Let's do this one quickly. These are the formulas here. Oh, Anthony, jump on board, buddy. How you doing, man? Good morning, Anthony. How are you?
Yeah, I don't know. I don't know what was going on. My camera wasn't turning on.
It's okay, man. Even technology takes a break once in a while. How you been? How's everything? How's studying?
It's going.
Now,
One of
let
those
me
days.
ask you this.
Yeah.
What do you feel that if you took the test soon would be
Mhm.
something that would be, forget about, don't tell me feel of failing. Don't tell me, I don't know. What is it? What else is it that is concerned you? Because you score very well. I know Dr. Anthony's scores are very, very high. He's doing amazing. But we all make silly mistakes. We get questions wrong that we shouldn't. We get questions right that we didn't know we could. That happens to everybody. So what is it with your prep, doc? Because I know your test's coming up soon.
Um, I think it like more or less like I know like I before I even started dedicated I knew that it was physically impossible to know everything. But
Yes.
I don't know. Like I feel that I have so many knowledge gaps and I don't even know like where to begin. I mean, I can do the questions that we do every day
Mhm.
and like the practice questions, but this is like a totally new experience for me. I think I mentioned it, but there weren't as many people. I never in my entire basic science career learned through questions. And that's kind of like I'm in uncharted territory. I used to like do content review, slide review, and then reinforce what I learned with the questions, not
Sure.
using the question as both the study and learning tool. So
Correct.
I mean, it is in a way because you never know. Like I could just be lucky with the topics that I've encountered are things that I know. There's some that I don't know. Like I don't get like all 2 and 3 hammers right. sometimes they get me.
So, but the thing that you have to also mention is, for me and you, for us here, I expect a lot from people when they join. And I also put the brakes on a lot of people. I am a person against starting to study with questions. People who come to me with a solid foundation or a decent foundation that says, either I failed once or I went through everything once or twice. You're on, let's say, online med ed. You've covered the material once. Then that tells me, okay, you've done it before. Now, I have other students I work with that have not started studying. And I'm like, don't even do a question. You have to spend 5 to 7 days, open up either online med ed, your notes, textbooks, get some PowerPoints, boards and beyond, whatever resource you need that you want to use, and spend 5 to 7 days. I know we all have done this at some point, to review in detail per system. See, because if you opened up right now neurology and you haven't done neuro in 6 months, you haven't really studied for neuro, there is no way you'll learn. The people who do that will never pass, because you can't take scenarios and then go backwards, right? Because it's kind of like it's not organized. That's the issue. For us here, though, I like, because you take what you know and you put to the questions today, for example. And then if you say, wow, man, I did 10 questions today, and like 8 of them, I'm floored. I don't know what's going on. That tells me I should go back and open up my videos and look at my notes again, because I'm missing something. You see what I'm saying? So that's why for you, I bring you up purposely in conversations, because you'll never feel comfortable. It's an advantage of being a pass or fail test. And all you got to do is pass every assessment test. Now, if you're passing every assessment test, there's no way you're that lucky. That's what I'm trying to say. So that's why I know it's the fear of, like, what if? And that's why I talk about, especially on a Friday, because there's always that what if approach, right? What if they do this? Well, I know, but people walking in and they're coming out passing. You don't come out feeling amazing. You come out thinking, oh, they kind of got me, because there's difficult questions and easy questions. So you'll never, ever learn everything. And the people that do never take the test. I have some colleagues of mine, 3 years they're still studying, 3 years. Close friends of mine, actually, I don't take my advice. They go, oh, I'm going to learn everything. And then every 6 months, they realize they forget what they did 6 months ago. So can you visualize the vicious cycle that they're 1 year in, 2 years in? So everything you did last year is obsolete because you don't remember it. That's why there's a certain timeline. And that's why I give you my approval that if you can prove what you have, NBMEs, certain assessments, and 120, my friend, there is nothing that can happen unless you walk in and fall asleep or walk in and the mouse has some possession of its own and doesn't even answer, just go see down the line, which never happens. Then my friend, you won't pass. But if there's no possession of any kind of evil spirits or no one jumps in on your behalf, an evil twin, you'll be fine. You'll be fine. All right. Yeah. So show us what you know. I want you to read the last couple of questions. Show us your formula, right? The one that we usually do. And I know I want you to just, and the reason why I do this is because if we feel too comfortable, this is the truth. If you feel too comfortable in USMLE prep training, there's a problem, right? There's always something to cover. I don't want you to ever feel that comfortable. I want you to be confident, not comfortable. Confident means, man, I can handle it. Comfortable means, yeah, I know this. No, but there's a lot of stuff you don't remember. So, for example, this one is a good review. We haven't done it recently, but I know you've seen it. I know you've done this, but you haven't seen it recently, right? This is a cycle of what I do with my students every day. We review stuff. So read the scenario, and it simulates the sense of, oh, I wasn't expecting this. Yeah, because USMLE doesn't play nice. So read the question. Let's see what happens.
Okay. So where do I start? Only medication. Only medication is a multivitamin. Appears fatigued. While measuring the patient's blood pressure, nurse observes a spasm in the patient's hand. So that's the Chopstick sign, right?
Okay.
Physical exam shows a well-healing surgical wound on the neck. Following ECG findings are most likely in this patient.
So do you, by the way, reading the last 3 lines, and everyone's different here, right? So like today, we're just going to see what you know to see how much you could connect. When you see the last 3 lines, does that tell you anything about a certain electrolyte imbalance? It's a certain kind of spasms. What's that What does
Or
that make you think?
hypocalcemia. Most likely they removed parathyroid, right?
Something, right? Something like low calcium or whatever it is, low calcium, right? We can go to the top and read the scenario. You don't really need to. If you did go to the top, you can see nausea, abdominal discomfort, diarrhea, numbness around the mouth, total thyroidectomy. Okay. So that confirms what we knew from before. So clearly you want to do that on an exam. But there's nothing when the USMLE says spasms, it's usually low calcium, like 99%, right? Okay. So now they take something that we know so easily, and you say, man, I know this. And you say, well, what do you see now in EKGs? Ooh, welcome to USMLE. They go, you know, low calcium. Now, I want you to do this. I don't want my doctors to ever go to the right answer, because if you know it, that's awesome. And congratulations. I'm preparing you for the worst case scenario, meaning you don't know the answer, but you know the answer choices. You don't know what the answer is yet, because there's no way on this earth, if you click next after every question, you're ready to get the answer. Sometimes it's not there, right? Because you don't know what you're expecting. Today you knew it was biochem, but I threw a curveball, right? Typically when we do focus blocks, you're like, I know today's cardiology. But the USMLE, every question we get is from everywhere in medicine. It's scary, isn't it? So I simulate the scariness to make sure you're prepared. Look at the answer choices, my friend. Can you knock out anything just like that?
I think so. Well, U waves, wouldn't you have U waves if they've had an MI,
What
right?
else do you see U waves in?
Um,
U waves, my man. You see U waves in, because now we're talking about electrolytes, right? Clearly, they're asking about electrolytes because they're saying, hey, listen,
okay.
EKG, the person has, because this is something where you connect with USMLE. They have spasms. What conditions have we done before that can trigger the thought of spasms? Like if I told you tetany, right?
Yeah.
Maybe talk about immunology. What kind of condition comes to your mind?
For like Clostridium tetani,
Yeah, that's for micro, sure. Immunology, like the Georges, right? The Georges catch
yeah.
22 that has tetany, right? So in cases as you keep moving, they're going to talk about low calcium. Okay, awesome. Now, low calcium versus high calcium. We talked this low calcium. Yes. When you see torsades de pointes, when you see U waves, for me, always I think of potassium. Always potassium. Now, is it hyperkalemia or hypokalemia? That's the trick. You want to know my trick? Huh? What is it? Hypo. You know how I remember it? Even though I know it,
Goes
when I
down.
see U wave, the U goes down. So I know it's kalemia, it's potassium, and wherever the U is going, pointing, that's going to be the wave. So this is hypokalemia. This is not potassium. We're not talking about calcium. Yeah, that's cool. Awesome. So this is wonderful, because if you know sodium, potassium, calcium, magnesium, and phosphate, guys, they're going to ask you that. That's what they do in the USMLE. They spoon feed you something. You're like, oh, they go, hey, psst, what happens in the electrolytes? What do you mean? That's on the EKG. You're like, oh, are you kidding me? Guys, play the game. Question, Anthony. What do we know about hypercalcemia? Hypercalcemia. Oh, man, you know this.
Hyper.
There's a certain mnemonic that we use. Remember we talked
chimpanzee.
about. Yes,
Right?
and also think this. Yes, and also think, guys, when you go to the hospital, some of us have gone before, if you're going, don't you learn a lot with clinical? Don't you learn a lot with hands-on experience? You do. It took me a long time as a student to realize the stupid scenarios in front of me are cases that I could see in the hospital. I mean, these are all kind of real cases. I mean, they're not absurd, right? So if you remember cases that we do, isn't the same as having a virtual rotation. So you say, oh, I remember that case that we did. The person had high calcium, and then they had like bones and groans and like psychiatric overtones and all that. Yeah, man, there it is. So instead of just memorizing words from a notebook, you attach it to a clinical scenario. So you remember the scenario that you did weeks ago, right? That's what you do in hospital, no? That's why residency is 3 years minimum. General surgery is 5. Neurosurgery is 7. You see cases. So my friend, what do you see in hypercalcemia again?
You see these like what we just said, like the psychiatric overtones, the bones,
Yep.
groans, stones, and psychiatric overtones.
Okay. So you see all the bones, groans, stones, thrones, all that stuff. Fine. Now, look at the other ones, man. Peak T waves. What's a peak T wave?
So peak T waves are hyperkalemia, and flat T waves are hypokalemia.
Boom. So that's nice. So now automatically, again, if you have an answer, click and go. That's fine. You don't need my help now. But I'm here to help you specifically when you don't know the answer. And also if you do know the answer, to eliminate facts, right? So we have, boom, potassium. Now we have torsades de pointes, we have QT prolongation, and we have PR prolongation. How do you want to go from here, my man?
So I know that like for the cardiac, the pacemaker action potential, the main driving force is calcium. Like for the cardiac, for the pacemaker action potential, not the ventricular. So I was thinking if you have um if you have hypocalcemia, wouldn't that would delay, that would actually delay your PR, right? It should. I think because the QT, like the QT prolongation, the driving force is like you have the sodium, then you have the transient, then the calcium, then the potassium for the ventricular. So I was
I'm
like,
listening.
I wasn't even looking at torsades. Like I was just between the PR and the QT.
Okay. So when you have torsades de pointes, can we take this guy out?
I think so.
Heads up, this is magnesium. Magnesium can cause torsades de pointes. I also want you to go over and review that as much as possible because torsades de pointes, many drugs can cause that. But we're talking about electrolytes now. Got it. Awesome. Now we're down to 2. The spasm is trousseau, and Chopsic sign is a twitching, right, when you tap the nerve. So we're down to 2. Now, if you listen to my advice, well, let's see, peak T waves hyper, same goes, PR prolongation wouldn't been sodium or calcium related, I believe. So if we're down to 2, QT prolongation versus PR prolongation, I'm going to pull this in. So these are the electrolytes that we see in the renal section of first aid. We have sodium, potassium, calcium, magnesium, phosphate. You need to know them all. But I'm going to go to calcium and potassium. Calcium, tetany, which we know, seizures, low calcium, QT prolongation, twitching, which is a Chopsic sign, and spasming, which is trousseau. We also know hypercalcemia. There's calcium everywhere, man, right? In the kidneys, you get stones. In the bones, is pain. Abdominal pain, there's the groans. Then you have urinary output frequency, boom. And then you have anxiety. And psychiatric overtones means that person's anxious, they're also mentally confused. So they'll say the person's confused. Yeah, they have stones, they don't feel good, the abdominal pain. That's high calcium, guys. Calcium's everywhere, right? Now, potassium, we did before. U waves, flattened T wave. Arrhythmias, we have muscle cramp, spasming, and weakness. On hyperkalemia, we have peak T waves. Okay. So every time you go back, please don't, meaning for all of us, please don't go back and review, it's peak T waves. But what else is wide QRS? Then there's also muscle weakness. So the more times you see a topic that you're familiar with, please go the extra mile to learn a little more about that. Or else all you're hoping is they give you and they test you on what you know. Problem is, there's a lot of components in every answer choice, right? In every section. Okay, cool. Sodium is this. We know sodium is very bad with coma. Like you have SIADH, right? If you have with slow sodium, don't correct it too fast because you can kill the person. So there's a coma on either side. So stupor and coma. Either way, sodium has to be normal. Too low, too high, the person's going to go into coma. That's bad. And then we have magnesium. All right, tetany. Okay, cool. Torsades de pointes. hypokalemia. And then phosphates this one here. So you see how we know a lot of information. But sometimes something leads us to a certain answer choice that like, man, maybe it's PR. But now it's not. It's QT prolongation. So then you read through it. And there's reasons, obviously, why we have low calcium, right? The most common cause is thyroidectomy or parathyroidectomy. Take out the thyroids and the parathyroids. And other common causes, vitamin D deficiency, and so on. That's why I love reading the explanations. Now, my man, look at this one. 12% went to U wave. We know now U is hypokalemia, and then flattened U waves. And then you have peak T waves. Boom. We know it's hyperkalemia. So buy one, get one. We know the low, we know the high. Doesn't this look familiar like with vitamin deficiencies? If we know the deficiencies, if we know toxicities, aren't we good? Right? Yeah.
Mm-hmm.
If we know, obviously, drugs like cocaine, PCP, marijuana, acid, meth, we know what happens when you intoxicate with it and then withdraw, right? If you know one, you must know the other. Constriction, dilatation, so on. Check out this, guys, PR prolongation. There you go. PR prolongation will be seen in hyperkalemia, which manifests with cardiac arrhythmias, muscle weakness, and weakened DTRs and diarrhea. The hyperkalemia can be caused by what? Transcellular shift of potassium due to acidosis or medications such as this. We're dealing with digoxin. You better know digoxin, you guys. You better know this inside out. They love asking you questions about digoxin, digitalis. Increase in total body potassium due to reduced excretion or medications such as potassium sparing. So anything that causes high potassium can do PR prolongation. So an example now. If you do this information, this could be any question you guys would do today, tomorrow, last week. If you realize, no matter what I do, I'm getting questions on this topic wrong, isn't it common sense to say, well, I should not go to first aid because that's really high yield. I should perhaps take a step back, and I'm getting pissed that I'm getting them wrong. Maybe I don't know the concept well, and use one of many video series that exist. There's no excuse at this point, right? Meaning I didn't have that growing up in med school. We didn't have these video series that you guys have today. So if you see you get the same questions wrong, you guys don't know it, which means you got to go back. If you get it wrong because it's a silly mistake, okay, guys, there's 1,000 things you have to review every day. No problem. Leave it to me to review it with you, right? Boom. Today, I throw this at you. So another less common cause of PR intervals is hypocalcemia. Oh, interesting. So not only did we learn about low lights, what happens, we also went on highlights. And also we know hypocalcemia, tetany, QT prolongation. We know hypercalcemia is the bones growing, psychiatric overtones, but also can cause PR interval. So yeah, this could be right. I think people chose it because they knew it was calcium, but it's hypercalcium, not hypocalcemia.
Yeah, I mean, looking back, hindsight is always 2020. But like as you saw, like I narrowed it down to like these two answer choices, and then I tried to use what I knew about like the action potentials and stuff like that to get through it. But
Sure.
now looking back at it, like since calcium is necessary to start the action potential and it's missing, then obviously the QT would have to continue if you're not starting the PR interval.
Yep.
But
yeah, you're right.
I mean, that's where my mind was going, but I guess my mind didn't catch up quick enough to catch on to that.
And the thing is, Anthony, this is not a time test right now. So I want you and everybody else here watching, everybody watching later, when you have it, because for the past 12 years, over a decade, the common denominator, besides many things, is I narrowed down to two. It happened in my generation too, and I always get the wrong answer. So that trickled into step two, and then I've hacked the system. I've hacked it. That's why all my step tours are minimum 240, high 272. My highest is 272. So I range. My average is about 255 on CK with all my students. The reason why is because you get them down to two, but then people choose the wrong answer. I'm like, oh, hold on a second. I give you guys a tip here forever, from now until you retire medicine. Support both answers. Don't try to get the right answer. Support both. if you can support both, not only does that depend that you have more knowledge, which you need, but then you say, well, there's only one answer, right?
Hmm.
So I have to pinpoint enough knowledge in the scenario and or findings that I know that's going to support both, man. Because now I would be like, you know what? I'm never going to get this question wrong again. I'm going to look at the answers and say, well, why is it not PR? I think it's PR. And then you read PR, say, oh crap, man, that's hypercalcemia. And then boom, that's also hyperkalemia. Versus now I know no matter what, why it's hypocalcemia. And then moving forward, every time you narrow down to two, don't be like a lot of other doctors out there, man. Try to support. And then even if you have to open up a book or after you get it right or wrong, support both again. Say, where in the stem should I have seen my support? Oh, I didn't see it in the stem because it wasn't there. It had to be here, right? Always go over your right shoulder, like figuratively. Don't reach over your right shoulder. Nothing's going to be there. It's over here. Where? It's up here. What do you mean? It's in the cloud of your brain. That's why you need to do it this way, guys. I'm telling you how to pass the test. Now, if you do it, you pass. If you don't do it, good luck. That's just tough love on a Friday. I mean, I'm just being, guys, this is the truth. If you don't do it similar to this, you're not going to do well because you're going to get slammed. My man, I hope you worked on your formulas, Anthony. I sent you a text message at 11 p.m. and 2 a.m. I'm joking. And I said, Anthony, memorize the formulas, bro. You need to know the formulas. Anthony, please tell me this question. I want you to attack it like a rock star like you are. Show the team here now and later how to attack this question.
Funny you should mention the formulas. I sent you my equation sheet for comp, especially with biostats. Beautiful. I didn't even know, like, I had every formula you could possibly conceive, couldn't figure out how to.
I will guide you, Anthony. I will guide you like I always do with all my students before they go in. I'll tell you what to keep on the chart. No, basically, we're talking about brain dumping on the exam. Mm-hmm. So before you walk in, you've written out 2 pages front and back. So when you walk in, you just dump it on the exam before you start your test, right? So I always help my students figure out what's best for them. So I'll help you out too, my man. Don't worry. And we'll put samples on our training hub, which students have access to. All right, buddy, let's do it. Formula away.
GFR calculated to be 105, and glucose clearance is calculated to be 103. Patients most likely being treated with which of the following agents? So taking a quick look at this, like he's clearly a diabetic, even though they didn't say that, and he's got glucosuria. So, you want me to go straight to the?
I mean, see, the GFR is is this here, and then the glucose clearance is this. Is this good or bad?
I mean, it's glucose in the urine. I think it's bad.
You shouldn't have anything. You should be zero. Yeah. Shouldn't have any. I mean, normal is about 100, but for sugar, no. Normal GFR is 100 milliliters per minute. But this is sugar we're talking about, right? Glucose clearance. You're not supposed to be urinating glucose. If that's the case, then you're diabetic, right? So, people jump to some formula. You see, it says GFR 105, glucose is 103. It's getting there. It shouldn't be that at all. Look at the answer choices. Can you tell me which one is, by the way? Tell me what each one is. What's this one?
So metformin is insulin sensitizer.
Sensitizer. This one?
That is SGLT inhibitor, decreased absorption in the kidney.
Good. This one?
Glipizide is the sulfonylurea, the ATP potassium channels.
Good. Buy one, get one. Because the class 3 is TINs, Tide and TIN, right? Tide is TID, TIN is TIN. So that's how you remember the class 3. But we have our own, by the way, there's no class 3. We categorize them as 1, 2, 3, 4. And then the TINs, that's the third class, right?
Yeah.
Boom. And Archibos?
GI absorption.
Yeah. So out of all these, which is the one dealing? Because I mean, tell us how you would approach this. So people who maybe haven't seen this question, don't know, can say, you know what? I don't know how to get this, man. I don't know the formula.
I mean, just using the breakdown that we did, like separating them into the separate categories. One's secretion, one is absorption, one is and where they are. So the only one that works on the kidney is the flozins.
There it is. why 64% should be 99. But I can tell you, I fell into the 25% category because I used to get them always wrong. I never really focused. I couldn't get farm under my belt. And then I have a team that always searches the websites and goes on Reddit. People reach out to us. I just can't do farm. My test is 7 days. I'm like, oh, that's not good. Yeah. Farm is where you get easy points, right? And then if you don't want to take this approach, then you just got to go each one and read off metformin, read this, read these, and I promise you, you will improve, because you need to think of it this way. We all mentor our students and our doctors and say, you have to work hard. You also have to work smart. Like old generation, you work hard and then you work smart. Work hard to get the foundation out of the way, and watch your videos, you read your notes, you write your notes, fair. Then you come on board and say, all right, I did all my work, but I still can't get questions right. Now we're going application process. We're applying, right, what you learned to questions. So people buy QBanks, people buy videos, and they go, what do I do now? Now you have to study and you have to review. That's it. So how will you tackle this stuff, Doc? What do you do to tackle when you study? How do you tackle all this?
I mean, I've just since we started breaking them into these different categories, it's hasn't been with the diabetic drugs especially. It's been very simple. Like cool. I found like the questions to be very, very like straightforward.
It's easier, right?
It's so much easier than just memorizing each individual drug. You just know the categories and you're there.
I got you, man. I got you. What I did for you guys today, there's 10 questions I want you guys to access on the Training Hub. I specifically selected a few that will be biochem. There's a couple of drugs from we've seen recently. There's a couple of questions genetics, a couple of questions DNA protein, a couple of questions in the metabolic pathways. But I want you to go through them one by one. Now you might say only 10. Well, if you use my formula, there's 50 plus explanations. So when you go through this question, for example, at your leisure, I need you to know what all these are. When you do a question like this, I need you to know what all these are. So you might do one question, but I'm expecting you to know Tay-Sachs and Gaucher's and, Niemann-Pick, because they can ask you questions on it. And then I can safely say, hey, I know my students know because I pushed them that far. You see these answer choices, you should be able to quiz yourself and say, what is each one? What each one is? And if you know what each one is representing, the game is almost over. You're going to win. But if you say, man, I don't know what this is, I forgot this, then you're not reviewing enough, or you didn't know it the first time. So we have to practice. That's why my technique is, as I pick questions for you guys every day and, throw it back at you, I want you to review a lot. Oh, and by the way, when you go to AMBOSS, if you're using AMBOSS, and you go to study plans and you go down to step 1, 200 concepts that appear in every step 1, and you read the scenario, it says literally 200 core concepts. I typically go here and I choose 1 or 2, if not more. So if you're with me for at least a month, you have all covered this at least more than once with me. So clearly you have all been covering 200 concepts over and over again in different ways and forms for step 1, which then makes me feel comfortable, because if you're reviewing and studying, even if you don't know why it's the answer, man, just know that's the answer. Make sense? Like I want you all to learn why that's the answer, but you don't have the time to learn everything again. That was med school for that reason. Now it's okay. The answer's in front of me. Do I know it? Good. Can I memorize it? Okay. Can I logically deduce it? Sure. Can I get the answer by limiting the answer choices? Boom, there it is. Pass the test, man. Pass the test, guys. And then step 2 is a whole different game. That's a fun game to play because it's actually test your knowledge. What's your plans for the day, Dr. Anthony?
To do these questions and do some rapid review, and then
rapid review.
Maybe some practice questions again.
So before we go, as you keep working, guys, I want you always to have a safety check. Be like, especially on a Friday into Saturday, say, okay, I've done X amount of work this week. Maybe tomorrow I could wake up and maybe do 2 blocks of 20 or 1 block of 40. no time of everything that I've done so far. Maybe a little biochem, a little micro, let me introduce changing topics in one block without having a timer on. Because if you're usually doing focus, that's awesome. But then transitioning to mixed can be scary. After you mix and you feel good, then you add time. You see, it's like layers, man, like baking a cake. You layer it. People are like, I'm going to go deep end with me. I'm going to do 3 blocks random time. I haven't done studying in 6 months and I got a 42%. I'm upset. Why? Did you think it was going to be that easy? If that's the case, then none of us would be here, right?